huge to explain everything in details due to our time, and I will try to answer you on a short way, and of course to be very clear. So vaginoplasty is a procedure, the surgical procedure, how to treat absence of the vagina. We have several groups of our candidates for this type of surgery. One group is congenital anomaly of the vagina as a part of some syndromes. Another group is transgender population. That is a main aspect today, and that is the most important to explain how to create a new female genitalia on the male body. We have several operative techniques for this, and the main operative technique is based how to use genital tissue to create a new neovagina. Sometimes, if we have candidates who already had some failed surgery, or candidates who has not good developed genital tissue, we have to use another parts of the body to create this organ. The most frequent usage on this way is using of colonic parts of our body, creating the very good depth and sensitivity of the neovagina. Additionally, especially in last 5 to 6, 7 years, we have a new option for transgender population, how to create a neovagina using the peritoneal flaps. This technique is very well known from female urology, especially in the cases who born without vagina. Regarding the surgical procedure, today, if you have experienced centers, we perform this as a usual procedure, as a surgery that is approximately 3 to 4 hours in a length, with a very high rate of the success. Sometimes we have some post-operative complications and late complications. During the surgery and immediately after surgery, it is always possible to have some minor complication that is possible to solve immediately. In opposite, since we are going to follow late complications, that was a base of our research and that we published in our journal. We have these late complications, and usually these complications are related for total absence of new created vagina. That is the worst complications, and thanks to God we never had this. Then another is a shrinkage of the new created vagina that is necessary to do some revision. And finally, we have some minor complications related to the positioning, asymmetry, or some other aesthetical points of genitalia. Thank you very much. This is a very interesting article, and we started to work on this very difficult congenital anomaly named epispadias more than 30 years ago. And our center, Belgrade Center for Genital Reconstructive Surgery, is very well known because we published our first results with the new techniques, with the improvements, with the outcomes in the last 30 years. And I think we published more than 10, maybe 12 articles. Last one that is published in our journal was based on the post-operative results in a long-term follow-up. Epispadias is very difficult complication, usually in males, that then incorporates anomalies of the penis. In this anomaly, penis is very short, separated, without urethra, and with a very, very marked deformity, like a curvature. So our techniques, based on our great experience in penile anatomy, are based on a very radical approach, how to disassemble the penis in all elements, how to correct all presented anomalies and deformities, and finally, how to join all of these entities in functionally and aesthetically acceptable penis. So our experience is really very huge, and we are one of the rare centers who published results in adults who previously underwent this type of surgery, not in our center, that in centers from all parts of the world. So in our series of 33 cases, we demonstrated our very, very open radical approach in dissection of penile entities, removal of all scar formations, and after that, reconstruction of urinary tract, that is new urethra, and also reconstruction of the penis. Our final results are in a more candidates, in majority candidates satisfied for normal sexual and psychosexual outcomes in adults. We know that new discipline in surgery is transition surgery, transition urology. That means what's happened with adult who previously treated due to some congenital anomaly in childhood. And you can find now more and more papers about this. I'm very happy that my team and me are one of the leading centers who promote importance of transition urology and who promote long-term follow-up in patients who born with a very, very difficult anomalies. It is not enough to correct anomaly and to forget your patient. You have to follow this. You have to live with your patients and try to correct all possible complications through the life, giving the best possible options for normal sexual life. One of the main research, one of the main points and goals is how to improve the life of this population. We described several new techniques, modifications, refinements in a treatment of these persons, but we are not satisfied. It was a reason that we continued to research for better and better solutions, to improve our knowledge, to improve our experience, and to offer more and more to our candidates. One of the main points of our recent research is how to use the organs that we usually remove from one body, how to use and to transplant to opposite body who are looking for these organs. With this, using our experience in transplant surgery, and we developed one completely new field of transplant surgery, it is transplantation of the genital organs. As a result of this, we did a transplantation of the uterus 2017. It was in the 11th case in the world who got a uterus, a transplant uterus from sister body. And 2 years later, 2019, we did a second case in the world of testicular transplant very successfully. And finally, we continued to work on this research, and now we have a very nice project under the project season, project cycles ideas 2020 related to the penile transplantation, how to transplant penis to the female body, to the trans man. That will be a revolution, that will be maybe the best possible option for our trans men who are looking for the good functional penis. Why? Because we now have a different options for phalloplasty, but we are not satisfied with the results of all of these well-known techniques for phalloplasty. For this reason, we started this research. We are now in our 3rd year, and I hope that thanks to the improvement of the medicine generally, for improvement in immunosuppressive therapy, that it will be possible to use our experience that we developed through our project research in cadaveric study, that it will be possible to use in a human population with the main goal to improve the life of these persons. Of course, this is very interesting, and I would like to tell you that we did this in November 2023, and I was a part of the great team great team leading from Gothenburg University. This is Sahlgrenska University in Gothenburg, and their chief, Dr. Mats Branson, and our colleague, Dr. Milenkovic, who was something between Belgrade University and Gothenburg University. And we did this ovary transplantation with one very good approach, minimally invasive with a good result. And we are looking now for a final result, because this is just a very short period, to see how it will work regarding the possibility to make a new babies and to finalize this, and also how to make implementation of our skills and this technique in a general medical practice that will offer all centers in the world to do this without any special problem. So I hope that it will be successful, like our two previously transplant organs, like testicle and uterus, because we already have in a uterus transplant, we have one delivery. In a testicular transplant, we already have one delivery, and we are waiting for second one. So I hope that our skills and our experience, together with the medical knowledge, will result and improve our situation now, and offer to everybody over the world who would like to have children, to offer this possibility with transplant surgery. I started to work as a surgeon, like first of all as a resident, 1992. So it is a little bit more than 30 years. So one full career, and through this career, I always try to find a new fields. I always try to open new parts of the medicine, and always try to improve life of my patients. Since I'm working with all population, children, adults, men, women, trans population, and that's everything is based for results and possible correction of the problems with the genital organs. I always try to find a new and new options and new research, how to make my professional life more satisfied. So one of the last issues is that I previously described, penile transplant. But I will tell you, for example, some of the very rare and unique cases that I had in my career. And each of these cases presented for me a great challenge. And I had a strong fight with myself. Is it possible? Yes, this is possible. I cannot do this. No, you can do this. So I will tell you just one very unique case that I did 20 years ago. Boy born with the two penises, but two non-functional penises, both with a distance more than 10 centimeters. So we did a surgery more than 12 hours and joined these two separated penises, brought these two penises in the middle and created one penis. And nobody knows at this moment what will be. I can tell you now, this small boy growed normally, and he called me a couple days ago to inform me that he finished his school, that he finished his college, and that he started to work, and called me to invite me for some celebration. So he is now 23-year-old, completely healthy, with a good genitalia, without any sign that he born with one on unique. This is just one case published in a literature through the centuries. And we did a good success and offered him normal life. This is something that fills my heart, that fills my soul, and that push me more to try to find always possible solution how to help to everybody over the world. To tell you that I'm very proud that I founded Belgrade Center for Genital Reconstructive Surgery, that is today one of the leading centers over the world. I will tell you some data. We have between 30 and 35 fellows who visit us every year, spend time with us, work with us, learn from us, and then promote our techniques in their countries. And I'm very proud that we have a good developed research center under our Belgrade Center. I'm very proud that I have my younger doctors who were recruited from the medical school and who continued to work with me, and now who are very well known in the world of the reconstructive urology. Also, I had fellows from all parts of the world who spent time with me and who continue to work, who are in a contact with me permanently. And for example, just today, that is some coincidence with your question, one of my fellows from India is going to open his center today, just today, and he asked me almost 3 weeks ago, he sent me a request and asked me if it is possible to call his new clinic with my name. So today he's going in India, that you know is 1.5 billion people, is going to open a center for reconstructive urology that will be named Miro Clinic. So this is a really big proud for me, and huge satisfaction that younger and younger colleagues showed interest to learn and to follow the same way how to improve a life of our patients. This is our goal finally. And another part is also that our center is very well known as a center who is permanently in a fight for human rights. We are going to support people from all parts of the world. We are going to work voluntarily to help and to change a life. We are going to travel to another poorly developed countries to give our experience, to perform surgeries, and it will be our way forever. And finally, I would like to close this question with my motto, that is always, always, and always forever together. And thank you for your invitation one more time. And I hope that our cooperation will continue to work in the near future. Yes, I would like to recommend to younger colleagues, to new generations, that just very hard work, good communication, energy to develop themselves through the research is the way how to be successful in this discipline. And this is a very long way, but I hope and I wish all of my colleagues long, long life. So this is a very long way, but our life is, thanks to God, always enough long to do this. It is not possible to finish everything in 1 year or in 2 years. This is a very difficult process, but young generations have to accept this and to continue. And I'm sure that in the near future, thanks to the new technologies and improvement in artificial intelligence, and then will result in a better and better solutions in the near future, maybe in 5-10 years. New generation will lead this process forever. My generation and myself finished some part of the history, medical history. So new generation, young doctors are here to continue to work and to change life on the different way.